Hello, everyone. My name is Natalie. I'm going to be presenting Behavioral Health Services, which is Chapter 10. In earlier years, there was not as much information on mental health as there is now. Those who were suffering from mental illness were confined at home in jails, and they received no care and suffered severely. A shift occurred, however, in the early 1800s when the first freestanding asylum was established and people with mental illness could receive treatment and continue with their daily lives. However, biological treatments were still ineffective and few people nationally could access such care. It was not until the 1930s that effective treatments began to arrive. This included drug-induced convulsions, insulin coma, electroconvulsive therapy, and psychosurgery. After World War II ended, the federal government became active in the mental health field. They established the World Health Organization and passed the National Mental Health Act in 1946. However, even with these changes, patients continued to be institutionalized in state-operated psychiatric hospitals. When countries started to push for deinstitutionalization and outpatient treatment, the movement became widespread, and the closure of state psychiatric hospitals in the United States was codified by the Community Mental Health Centers Act of 1963. An establishment that helped attack the quality of care was the Joint Commission on Mental Illness and Health. The commission provides resources for those who are mentally ill and also paved way for Social Security and disability insurance. New medications and treatments were developed to provide effective results outside of the hospital. The following video is an example of the stigma that surrounds mental health even today. It's also an example how we can break down those barriers by bringing about mental health awareness. Once the federal government started to intervene and help finance mental health care, it led to the expansion of mental health facilities and health professionals specializing in the mental health field. However, with the increased number of patients receiving care, facilities and insurances started to limit the care and using capitation methods to control costs, ultimately creating a non-parity establishment between mental health illness coverage and insurance coverage for other areas of health, therefore increasing the cost of mental health care and making it unobtainable to some people. Mental health service funding was made easy by the Mental Health Parity Act of 1996. This law allowed for many cost-shifting loopholes such as setting limits on psychiatric inpatient days, prescription drugs, outpatient visits, raising co-insurance and deductibles, and modifying the definition of medical necessity. Due to the historically inadequate healthcare coverage, most people suffering from severe mental illness receive coverage through publicly funded insurances such as Medicaid. The future of mental health can become brighter by continuing to perform studies on mental health and all its complexities and produce findings that support the move toward fully integrating psychiatry and behavioral health services with primary care. The implementation of the Affordable Care Act has helped millions of Americans obtain affordable health insurance and mandate parity of behavioral health benefits. As health insurance becomes more obtainable, the goal is to improve overall health services with increased access to psychiatric and behavioral health services. The following video is a great way to end on a positive note, as well as looking forward to a brighter future for mental health for those patients who truly need it. Thank you.